So, whether you've been trying to conceive for a while or you're just starting, I've got you covered because in this video, I'm going to be giving you surefire tips that will greatly and significantly improve your chances of getting pregnant. And for you to be able to achieve this result, be sure to watch till the end and also put into practice all that I'm going to be telling you, because just missing one or two could just be the reason why you've not achieved that little miracle you've been expecting for a while. I also want to let you know that when it comes to conceiving a baby, it can take quite a time. Yes. And also, you should know that according to research, only 30% of people who want to get pregnant actually achieve that within their first month of trying. Also, 1 in 4 couples could even be trying even after 1 year. So don't let that bother you, because there are a lot of people who are in that situation, and by using the right information, advice and treatment, they've been able to get just what they want. So if you see me for the first time, my name is Peace Tracy. I'm a registered nurse and midwife, and I currently practice with NHS in England. So in this channel, we talk about women's health, fertility, and everything health. If these are topics that interest you, consider subscribing to my channel because you're going to benefit a lot, and I release videos on this topic every week. So let's get into it. My first tip is maintaining a healthy weight. This is a very important thing to do in order to achieve pregnancy, because having a healthy weight greatly improves your chance of getting pregnant. When we talk about having a healthy weight, it's not just by looking at a person and saying, oh, you're slim and so you're good, or you're too fat and so you won't be able to get pregnant. No. Having a healthy weight means having a BMI that is within the acceptable range. Having a BMI between 18.5 to 24.9 is acceptable. That is the normal range of BMI. And for you to be able to calculate your BMI, you should be able to do this by dividing your weight in kilograms by your height in meters square. For instance, if you have a weight of 60 kilograms and a height of 1.6 meters, you will have to say 60 kilograms divided by 1.6 times 1.6. That gives you your BMI. So if you do this and you find out that your BMI is above 24.9, then you should be worried about your weight. Now, when we talk about having a healthy BMI, it doesn't necessarily mean that if you don't have a BMI within this range that you cannot get pregnant. That's not what it means. But having a BMI within this range greatly improves your chances of getting pregnant, because when you are overweight, it leads to you having high levels of leptin, which is produced in the fatty tissues. And this actually reduces your chances of getting pregnant by disrupting hormone balance. And when your hormones are not properly balanced, it makes it more difficult for you to get pregnant. Also, having a high BMI can inhibit ovulation. Next, when we talk about having a healthy weight, it is very important, because when you have a very high weight, or that is when you are overweight or obese, it can lead to some kind of pregnancy complications like gestational diabetes. It can also lead to stillbirth. Having maintained a good weight, the next thing is to cut your caffeine intake. Yes, cutting down on your caffeine intake is absolutely important and will greatly increase your chances of getting pregnant. Now, when we talk about caffeine intake, a lot of people just think about coffee, but you can get caffeine from different other sources, from your tea bag, from your herbal teas. You can even get it from a lot of these beverages that we take for energy, the energy drinks. So all of these can give you caffeine, and cutting down on the amount of caffeine intake can really help to boost your fertility. But this doesn't mean that you cannot take your coffee, no, but this means taking it in moderation. It is recommended that you take less than 200 milligrams of coffee a day, and taking that would really not have any negative impact on your fertility. Second point is taking your prenatal vitamins. This is absolutely important, because you don't just want to have a baby, but you want a healthy baby. Why do you need to take your prenatal vitamins? because they help to prepare your body to be able to accept that baby. And when it comes to these prenatal vitamins, it is recommended that you focus on taking enough of folic acid. Why do you need this? Because this folic acid helps to prevent the occurrence of a neural birth defect known as spinal bifida. This spinal bifida is something that usually occurs when a woman does not take enough of folic acid when she's pregnant or even before she gets pregnant. So it is recommended that you take at least 400 micrograms of this folic acid on a daily basis at least 3 months before conception and even up to 12 weeks of pregnancy. But when it comes to taking folic acid, some women may need higher doses of folic acid. These are women who have special circumstances. People who may take higher doses of up to 5 milligrams are women who are diabetic or taking anti-epileptic medication, on antiretroviral drugs. Other circumstances could be if you've had a previous pregnancy that was affected by a neural tube defect, that is this spinal bifida, or you or your partner has neural tube defect, or you or your partner's family has a family history of neural tube defect. In that situation, it is recommended that you may be able to take up to 5 milligrams of folic acid. But this is not like me recommending this for you. It has to be a decision taken by your healthcare provider for you to be able to protect your baby from this harm. Next is right timing for sex. This is absolutely important. In fact, if you do every other thing without getting this right, you will still not be able to achieve that pregnancy. So having sex at the right time is really important. And when is the right time and how often is recommended? When it comes to when is the right time is having intercourse during the times when you are fertile. Now, as a woman, you have to track your ovulation to know your ovulation period, because your ovulation does not last for so long. An egg is released, and when an egg is released, it can only last between 12 hours to 24 hours. So that is such a short time frame for the egg to last. And the sperm, on the other hand, can last between 3 to 5 days. So having intercourse in the days just before your ovulation is highly recommended. And having intercourse every other day or every day, as is possible for you and your partner, is something that is really going to help to improve and boost your chances of achieving pregnancy. So when we talk about right timing, you must make sure that you're having sex during the time you are ovulating or just a few days before your ovulation. By so doing, there will be sperm waiting for the egg to be released, and this makes all the difference and makes you achieve that which you've been wanting. So the importance of a healthy diet when trying to conceive cannot be overemphasized. So when it comes to eating healthy, it is recommended that you eat food that are rich in leafy green, complex carbohydrates, and lean protein. Also, try to take a lot of fruits like citrus that are rich in vitamin C. Also take nuts, something like walnuts. Then think about protein sources like sardine, mackerel, and other forms of proteins. Foods like tomatoes have been found to be rich in lycopene, and this lycopene helps to improve sperm motility and sperm count. So it's really important that you eat these fruits. And when it comes to this lycopene, when it is cooked, it increases its quantity, and also the body absorbs lycopene when it is cooked more easily and more faster. So the importance of healthy diet can never be overemphasized in this journey of trying to conceive. The next point is avoidance of smoking. This is something that really is very important to be done. So if you're trying to get pregnant, it is very important that you quit smoking. I know it's not very easy for a lot of people, but if you really need help when it comes to quitting smoking, you can seek help from your general practitioner. For instance, in the NHS, we have the smoking cessation services. They will be able to really work with you every step of the way to help you quit smoking. And when you do this, you will really enjoy the process. This is because when it comes to smoking, smoking can really affect the ability of the sperm to fertilize the egg, and it can also reduce sperm count. So it's not just for the man when it comes to smoking, also for the woman. When you smoke, it makes it much more difficult for you to get pregnant compared to a woman who does not smoke. The next point is avoidance of alcohol. So in this journey of trying to conceive, when it comes to alcohol, it is non-negotiable. Yes, it is totally non-negotiable. So if you're trying to conceive, avoid the use of alcohol in all of its forms. And also when you get pregnant, avoid alcohol because it can cause what we know as fetal alcohol spectrum disorder. So this is something you wouldn't want your child to have, such that after going through the stress of pregnancy and having a baby, you still go ahead to, have all of that problems that come with sickness in a newborn. No, it's not something you want. So the best thing is to avoid the intake of alcohol before and during pregnancy. This will really help you to achieve that pregnancy and also have a healthy, happy baby. Being physically active is one thing that will be really helpful when it comes to trying to get pregnant. Being physically active does not just help you to maintain a healthy weight, it also helps in managing insulin resistance, which is one of the factors that we talk about when we are talking about women who are finding it difficult to conceive. So when we talk about maintaining a healthy weight, it is really absolutely important because it does not just help you in getting pregnant, it helps with your overall well-being. Preconception counseling is another thing you have to do in order to help you achieve pregnancy faster. When it comes to preconception counseling, it is very important that you do this because in this case, you have to visit your healthcare provider, have a detailed discussion with him, and in this discussion, your gynecologist will have to take a detailed history about you. This gives him an idea of who you really are and how best to help you. Now, having this discussion will also help him to be able to access your vaccination status. For instance, something like the rubella, the German measles, is something that if a pregnant woman catches it, it can really harm the baby. So it is important that you have this pre-counseling with your healthcare provider. Get all the required vaccinations done so that even when you achieve this pregnancy, you are sure that you will be safe and your baby will also be safe. Also, in this preconception counseling, your healthcare provider will have a review of all your medications, look at them, tell you which ones you should be taking and which ones you should stop. Because some medications can actually have a very negative impact on your fertility, and that could just be the reason you've not been able to conceive. So consider going for a preconception counseling because that could just make a difference in what you've been wanting. And last but not the least is the avoidance of stress. Stress can really be very, very detrimental, not just to our health, but to our fertility. Both as male and female, we should try our best to avoid chronic stress. It doesn't mean you shouldn't work or do any day-to-day activity. No, we are talking about chronic stress because chronic stress has been linked to preventing or limiting ovulation. In some situations, it can really cause more serious damage to a person. So it is very important that as you try to do all of these, you try to manage your stress and avoid any form of chronic stress. By doing all of these, you will be significantly increasing your chance of getting pregnant. Thank you so much for watching this video and for watching till the end. If you got value for it, do not forget to hit the subscribe button because in this channel, I talk about women's health, fertility, and everything health. So thank you for watching and I'll see you in my next video. Bye for now.